Hi guys, it's Dr. McCoy here at Drummond Chiropractic. I'm going to go over a couple of the techniques that we use for our osteoporotic patients or patients that don't like the higher force adjustments and different things like that. So the main one that we use is the flexion distraction. That's where the end of the table kind of flexes up and down here while I hold a little pressure. What that does is it gaps the facet joints and the disc and everything else in your lumbar spine, the muscles, to help kind of decompress the spine a little bit, so we can get some motion in those joints and into the disc like we would with a higher force adjustment, but we do it with lower pressure and using the table. So what that looks like, the lower half will flex up and down. I'll hold a little pressure throughout the lumbar spine, and then all the segments below that get to kind of gap and decompress a little bit. Next one we use is drops. That's where the part of the table kind of pops up, and then we apply a little pressure, and then the table helps with the rest of the adjustments. That looks like this for the lower back. We hold a little pressure, and then the table falls right underneath, where we don't have to use as much force or speed or anything like that to get some motion into the hips, into the lower back if need be. The other one is using instrument. This instrument is called the activator, and this works by speed. So you hold a little pressure, and then it gets motion into the joint with the speed, so you don't have to use as much. I use this a little bit more in the cervical spine, but you can use it anywhere throughout the spine. It has some different settings on it, different things based on that. But we can also use this as a setting. The last thing, and that we do with all our patients, but especially since we're not using the higher force adjustments, we will be using a lot of muscle work. In whatever trouble area you may have, we'll see where the compensations are and different things like that, so we can get you moving and get you back to whatever activity that you want to get to. Thanks.